Hi, this is Dr. Ankush Malhotra from Anesthesia Blueprints. Today we will talk about inhalation anesthetic agents. So what are inhalation anesthetic agents? Before the invent of anesthetic agents, surgery was so painful and you can say disaster for a patient to get operated by any surgeon. So anesthetic agents are of two exist in two form: volatile agents and gaseous agents. Volatile agents which have tendency to get evaporated at certain temperature or certain pressure. Gaseous form are nitrous oxide and xenon. And volatile agents are mnemonic is DISH, DISH, D for desflurane, I for isoflurane, sevoflurane, and halothane. Inhalation agents are used for induction of anesthesia in pediatric population and maintenance of anesthesia in all general anesthesia cases. What is MAC? MAC is minimum alveolar concentration, or you can say that it is a surrogate marker of anesthetic concentration in the brain. MAC1 is minimum alveolar concentration at which 50% patient do not respond to surgical incision, or you can say surgical noxious stimulus. MAC immobility. MAC immobility is 1.3 MAC is known as MAC immobility. It is a concentration in the lungs at which, or you can say in the brain, at which 95% patient will not respond to surgical stimulus or noxious surgical stimulus. MAC bar is 1.5 or 1.6 is known as MAC bar, at which patient's autonomic reflex gets blunted. Patients do not respond to surgical stimulus with tachycardia or increase in BP. That is MAC bar. MAC awake. What is MAC awake? MAC awake is 1.3 MAC is known as MAC awake, at which 50% patient will respond to verbal command. MAC amnesia. What is MAC amnesia? MAC amnesia is lower than the MAC awake, at which 50% patient will not recall what happened in OT or what happened during surgery. That is known as MAC amnesia. MAC value of halothane is 0.7. Always remember 0.7 is MAC value of halothane. And next is isoflurane. 1.17 is MAC value of isoflurane. And next is sevoflurane. MAC value of sevoflurane is 1.7, or some book says 1.8. And last is desflurane, 6.6. Highest MAC value is 6.6. Highest 6.6, lowest 0.7. And in gaseous agent, MAC value of nitrous gas is 104, 104. Xenon, it is 63%. So MAC value with MAC value we can compare potency or efficiency of the drug. Lower the MAC value, faster is the induction. Higher the MAC value, slower is the induction. You can say halothane 0.7, patient get inductions faster, and if 6.6 is a desflurane, patient's induction delayed in 6.6. So what is 0.7? It means if you open halothane at 0.7 percentage of concentration, and it will achieve MAC 1. 1.17 isoflurane, you have to open 1.17% at the dial, so patient can achieve MAC 1. So 6.6 for desflurane. So this is the significance of MAC value.